Thank you, Mr. Chairman. This is for Commissioner Bussin. As we know, children growing up today are growing up in a way different climate that they did previously. So it very much interests me about your school outreach program. Can you elaborate a little bit more about what that process entails? What's the type of funding that it requires to staff a school district? And just a little bit more about the program in general.
Sure. The program that we're piloting now, we're going to put, as I said, 3 of our schools will get one full-time person, a former caseworker in our mental health or intellectual disabilities department will be in the school, and there'll also be a supervisor who will work as kind of a rider, a county rider throughout those schools. So it's a 2-staff position. We're getting cooperative support, including funding from our school districts, and this is a united decision by our school districts. They're begging for this kind of support. They have support services. They have guidance counselors. Some of them actually have psychologists on staff, and those are the ones that we're not going to hit right now. But it's not terribly expensive when you think about it. I mean, we're already paying the expense of the individual on our staff. We think some of the buyback on that is that we can, through early intercepts, by getting people into treatment or at least counseling and giving, building family strengths, keep them away from maybe the CYS side, where now we're going to have to double down on coverage, maybe involve the criminal justice system, and that's just a much more expensive and more difficult thing. So we really think this is smart money being invested in these schools. And as we've been talking about and alluding to, the overall increase in crime and delinquency and the issues that we keep seeing, the violence, if we can't get in early, I think we start from way behind the starting blocks.
If I can make a quick comment on that. Sorry.
We all care about this.
Yeah, no, you were talking about sort of the cost offset, and virtually everything in this, whether it's housing, employment, crisis services, drop-in centers, has an obvious cost offset in the traditional medical and mental health service expenditures. The problem is often things get put into buckets. So you spend here, which is great, but it's saving the managed care company over there. Or you're saving in prison system, but it's costing it. So really we're coming to you with, you're one of the few areas where you can see the whole picture and you see all the buckets and how does it work? Because often in the community it gets pulled out like that, but clearly there's a benefit to the person and overall expenditures to the system when it's done right.
And I just want to echo that. I think it's so important to see, again, the whole picture. So we have 22 school districts in Montgomery County. And so as their budgets get tighter, they're coming to us for the same type of help. And we do have school assistance programs, and they have been growing as fast as we can afford to grow them. But one of the things I want to tie this all together is that school is such an important place to intervene, but we can't lose sight of the whole family. So for instance, we know now about adverse childhood experiences. And we know that children that experience either domestic violence or food insecurity or homelessness, they are so much less likely to graduate from high school. And we have the data. It is crystal clear. And so having the supports in the school is even more important, I think, than it used to be. And also, though, making sure that we don't ignore the parents so that we can hopefully intervene so that that family stays whole and that that child does not experience adverse childhood trauma that we know directly correlates with their likelihood of being able to be a graduate of high school, a graduate of college, and a member of the workforce ultimately.
If I could, I'd also add that the value of this kind of base funding and the flexibility we get generates a lot of savings. You get a lot of bang for the buck in these programs. We talked about residential housing, and I just want to real quick, in a different category, we set up a step-down house for inmates coming out of our jail, right? These are folks that have served their minimum, but they don't have a housing plan, so they're either going to stay in jail and finish their term and get kicked out the front door, right, or we provide them something. So we rent a house, we lease it, we use grant money, PCCD grant money for the first 2 years of this program. And in a prison system in ours where we have something like 62% recidivism, we've put 24 men through that program in the last 2 years, and we're at about a 20% recidivism. And we've done that for about $60,000 a year, 25 individuals, the majority of whom have been broken free of the criminal justice system. Now, we were able to do that because every one of them has a substance abuse disorder. We use these centers of excellence to provide that wraparound service. We want to do the same thing for other mental health services. That's the freedom we get through base funding.